This is Brian Schiff with Functionally Fit. In this column, I'm going to review some soft tissue therapy techniques for the neck and the upper back. It's a common area that I find clients have multiple trigger points in, chronic tightness, and poor posture, and a lot of the things we do in our society today contribute to myofascial pain in that posterior chain, or faulty alignment, and different things that can really impact a person's quality of life, their well-being, and of course their ability to be fit and active. So I'm going to show a technique using a revolutionary new roller called a Rollga roller. And so I've got two of them here today. This is a Maliper roller, and it is a softer roller versus the black one pictured here that is a Rollga Pro roller, and it's extra firm, so it's much stiffer in terms of its density, but you'll notice that there are some grooves cut out in this roller. So it provides for different zones of soft tissue work, and really it's one of the first rollers of its kind that's going to allow a cutout for bony landmarks, if you will. And so I really like it for that reason, because we're going to be able to allow the spine to be offloaded here and kind of sink into this part of the roller. I'm going to demonstrate that for you. And so keep in mind that a lot of times with soft tissue work, it may be easier to begin with a softer roller for clientele that are less experienced with it or who have discomfort. So for this first technique, I'm going to actually put my neck in what's considered to be zone 1 of this roller. So I'm here supine, and I've got my spine nicely tucked into zone 1. And then it's really simple. You're just going to have the client nod their head up and down, or kind of back and forth gently and slowly, as if they're drawing a little line on the ceiling with their nose. So you can kind of move back and forth and work on those muscles and soft tissue on either side of the spine. So you can work for 30 to 60 seconds or 5 to 10 repetitions, but it should be slow, it should be smooth. And then we can also have them rotate the head left and right very subtly. So I'm moving back and forth, allowing some compression therapy to occur on any kind of tight areas. And most people are going to have a lot of tightness in their levator scapula, their upper trapezius. And so this is, or even in that suboccipital region, that can create tension, headaches, and problems for them. So really nice technique for the neck. Now if we want to work the upper back, we're going to move so that the roll would be in a position of kind of underneath the shoulder blades, if you will. I'm going to cradle the head with my hands to support my neck. And then I'm just going to use my legs to move slowly up and down. Again, the roller is allowing me to cradle the spine and work on that soft tissue. You're going to stop at about the point of the lower ribs and then slowly roll back up. If I want more pressure, I can obviously lift up and increase that pressure gradient by coming up off the ground to my backside. And again, going to roll for about 30 to 60 seconds, provide nice compression therapy there, and really adjust the pressure gradient based on what the client feels. If they want to camp out on a sore spot, hold for a few seconds, that's obviously okay as well. If the pressure on the floor provides too much discomfort, you can always begin by standing on a wall and offloading that way. And then as the client acclimates and they want to advance the pressure intensity, then you could obviously move up to a higher level density roller such as the Rollga Pro. So anyway, great technique to really work on mobilizing the soft tissue in the neck and the upper back. Can really help improve posture, alignment, reduce chronic pain, and optimize movement pattern for your clients in their life.